I'm Dr. M. Kumar, and today I'll be detailing about how to perform CPR on anybody whose heart has stopped beating. Before we proceed, let's discuss about CPR and what is cardiac arrest. CPR is Cardiopulmonary Resuscitation. Cardio is the term related to heart. Pulmonary is the term related to lungs. And resuscitation means bringing somebody back to life. Let's discuss about what is cardiac arrest. Cardiac arrest is a situation in which the heart suddenly stops beating. This happens just because the SA node and AV node, which are the natural pacemakers of our heart, stop sending electrical impulse to the heart muscles. Actually, this SA node or the pacemaker's function is to send electrical impulse for the heart muscles to keep pumping so that the heart will keep beating. So, till the time this electrical impulse is being sent to the heart muscles, the heart will continue beating. But if this impulse stops, means this current stops, suddenly the heart stops. The purpose of heart is to circulate the blood throughout the body. The blood which contains nutrients, which contains oxygen, has to reach each and every part of the body, each and every cell of the body. So, if heart stops beating, then the nutrients and the oxygen are not being delivered to the different parts of the body or different cells of the body. If the cells are not receiving nutrients, there is no problem for some time. But if the cells are not receiving oxygen, then it is a great risk. Particularly for the brain. Brain cells cannot survive for more than 3 minutes approximately without oxygen. It needs oxygen regularly. So as soon as possible, if we are able to give the person CPR, then we are able to provide the brain with enough oxygen so that it can survive, and we can keep the heart pumping artificially so that it is circulating the blood towards the brain also. Now I'll show you how to perform CPR. Let's consider a situation in which somebody collapses suddenly. As a bystander, what should I do? Instead of running towards him, immediately we should think about our safety first. If we are running towards him, it shouldn't be as such that any other vehicle comes and it runs over me. Thinking about my safety, looking all around, I'll be reaching out to that person. And then these are the processes which I am describing now. First, we'll be seeing whether the person is awake or not. If he's awake, if he's responding, no problem. We'll be taking him to the hospital, or we'll be knowing about his problem and he'll be able to reveal. So it depends upon the situation. Suppose the person is not responding and is not awake at all. Then first we have to call for the ambulance. Then we have to see different levels of responsiveness. First is whether he is responsive to voice or not. We'll ask the person, hello, are you okay? Any problem? Please speak out. What's your name? Hello. So by this, we can understand whether he is replying or not. If he is not replying, then he may be unconscious or he may be having some problem, which will be diagnosed just by the second step. If he is not responding to voice, then what we do? We check for pain. Means maybe he is not able to speak, but he is in his senses. So by giving pain to him, he will respond to the pain. He may move his hand also. He may move his body. He may try to prevent himself from the pain. So that will let us know whether he is conscious or not. So this is the second step. And to know about whether he is having pain or not, this is the perfect position to pinch this. We can pinch, we can just press here also, just behind the collarbone. But this is not very appropriate. This is the best. And this is not harmful at all. So what we do is you just come to that person, and after seeing that he is not responding to my voice, we try to pinch here. We press this muscle. If he is not responding to that also, then we have to see for the pulse. The pulse can be felt in the radial also. This is called radial pulse. But usually what happens, if the pressure goes very low, then this pulse fades away. You cannot feel the pulse. Even if the person is alive, his heart is beating, then also this pulse cannot be felt. So the most reliable place to feel the pulse is this carotid pulse. And how to find the carotid pulse? With your 3 fingers. It can be felt with 2 fingers also, but since everybody is not experienced, so 3 fingers are the best to know the pulse in that limited period of time, because we are running short of time. We have to give CPR also if the heart is not beating. So beside the trachea, we'll be pushing our 3 fingers and we can feel the pulse here. You can just try it out and you can find both the sides you can feel. So we'll be checking for the pulse, carotid pulse. If the pulse is there, means heart is beating. Now we'll be checking for the breathing process, means the person is breathing or not. Now how to check whether the person is breathing or not? The best process is to hear the sound of the breath. And while listening to the sound, we'll be seeing the chest movement also, whether the chest is going up, down or not. This is the best process. If he is breathing also, that means he is unconscious. In that case, clear the airway by lifting the chin and pushing the head back. Then lift the legs so that maximum amount of blood reaches the brain. Keep him in this position till the help arrives. Now, if we see that the person is not breathing, in that case, we have to provide oxygen in his mouth. So, before giving mouth-to-mouth respiration, we have to see whether there is any foreign body, means maybe that person may have been chewing something or he would have been eating something. So, we have to just open his mouth and see. If something is there, we'll have to take it out. We have to turn the person in this way towards one side, and then after opening his mouth, we'll be with one finger, we'll be taking it out. Confirming that there is nothing in the mouth, then we start mouth-to-mouth ventilation. Every 5 seconds, one mouth-to-mouth ventilation has to be given. How do we do that? First, as I said, this is the main important thing. We have to pull the chin up and take this head backward so that air passage is cleared. Now, holding this nostrils, we have to press the nostrils with our thumb and first finger, and holding this chin, and with this palm, the side of the palm, we are pressing his head back way, in this way, and holding both the nostrils, pulling the lower jaw down, we'll be just release the nostrils. And when we have released the nostrils, in between we have to check for the pulse also, because there are chances that a person who has lost his breath may lose his heartbeat also, means his heart may stop anytime. So we have to keep checking for this and keep providing that oxygen through mouth-to-mouth ventilation to the patient. And this has to be done till the medical help arrives or the patient is taken to the hospital. Now the third case, in which we find that there is no pulse at all, means the heart has stopped beating. In this case, we may find that the person may be gasping. We may feel that the person is breathing, but that is not breathing. If he has just fallen and his heart has stopped beating, then he would be gasping. It may look like in this way, means the body is striving to take oxygen, though he is not breathing, because brain is demanding oxygen, so this gasping occurs. So we should never get mistaken gasping with breathing. So in that case, if we see that his heart is not beating, we have to start performing complete CPR. Complete CPR means 30 chest compressions, after that 2 mouth-to-mouth ventilations. Again 30 chest compressions, after that 2 mouth-to-mouth ventilations. This process has to continue till the patient is taken to the doctor. In between, keep checking for the pulse. There are chances that within 5 minutes, within 4 minutes, within 3 minutes, or within 10-15 minutes, the person may revive. So you have to keep trying, so that even if the person is not resuscitating, is not reviving, till the time he is taken to the hospital, at least his brain cells are alive and doctor will take care of the situation. But if we do not do anything, if he reaches the hospital 10 minutes later, then most likely he may not survive, just because his brain cells have died. So now I'll be showing how to perform CPR, complete CPR. How can I understand which is the exact place? It should be just at the mid of both the nipples. If we draw a line, then just at the mid of this line, this is the exact place. If she is a woman, then the armpit hair, that lining just below the arm, this is the exact place. Now with my right hand and this left hand, this elbow should not bend. and then without bending this elbow, I'll be compressing this around 100 to 120 compressions per minute, and the speed will be just like what I'll be showing now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After 30 compressions, I'll have to look into the mouth whether something is there or not. Before pushing air inside, I have to get confirmed whether mouth is empty or not. If something is there, I'll just pull it out, and then again in this way, tilting the head back and closing the nostrils, pulling the jaws down, releasing the nostrils, again two over, again immediately just after the second gets over, again I'll start with 30 compressions. 1, 2, 3, 4, 27, 28, 29, 30. After 30, again one, 2, 3, 4, 5, 6, 7, 8, 9, 10, 30. So this shall continue. This we have to keep continuing till the patient is taken to the doctor in the hospital. Means even if the patient is in the ambulance, we have to keep providing this to him. Otherwise, if the circulation stops, if the oxygen is not received by the brain, then the brain cells will be dead, and that will be a permanent damage. Most of the cases, it is seen that the person revives before reaching the hospital. But if this is not provided within 3 minutes approximately, then the damage is irreversible and most likely he may not survive. So this was all about the process of giving CPR to anybody whose heart has stopped beating or who would have stopped breathing also. To give CPR, it's not necessary that you should be a medical professional. Anybody who knows the technique of giving CPR has the right to give CPR to anybody who is in need, whose heart has stopped beating. Because by the time the patient reaches the hospital, it's too late. So I think this video was helpful, and by learning the technique of CPR, you would be able to save anybody's life who will be in need. Thank you so much. Happy learning.